Health Cabinet Secretary Aden Duale has dismissed a fact-finding report on organ transplant trafficking that was presented by the Kenya Blood Transfusion and Transplant Service, saying it was doctored. The report came from a 12-member team from various organizations who had been tasked with investigating an alleged organ trafficking syndicate at the Medihill group of hospitals in Eldoret in the county of Uasin Gishu from December 5th to December 8th, 2023. Duale further revealed that he has set up a new committee that will look into the matter before presenting its findings by July 22nd this year. NTV's Helen Aura now reports.
Morning, Chair, honorable members, CS.
Appearing before the National Assembly Health Committee, Health Cabinet Secretary Aden Duale was tasked to respond to a number of queries in relation to the ongoing organ trafficking syndicate probe at Medihill Hospital. The key issues included the legality and ethical integrity of the kidney transplant procedures at the Medihill group of hospital.
If things happened before you came in, even when you come in, you still take responsibility.
Duale stressed that despite the team being constituted by the Ministry of Health, the report was not endorsed unanimously due to significant dissenting views among the team members.
Furthermore, the report was not formally presented to the Ministry of Health for consideration and action. And as a result, the findings and the recommendation from this report are deemed not binding and without any legal or administrative standing.
According to the findings, Medihill Hospital and Fertility Center in Eldoret has since successfully conducted a total of 372 kidney transplants, with most cases from Kenya, Uganda, Ethiopia, Burundi, DRC, Somalia, and a few from Australia, Israel, Japan, USA, and the United Kingdom. Further, it revealed 80 kidney transplants were conducted between November 2018 and February 2020, while 70 transplants were conducted between September 2020 and July 2021. 150 kidney transplants were also conducted between July 2021 and February 2023. 72 transplants were conducted between February 2023 and November 2023. The findings also showed that 70 of those who underwent transplants were over the age of 60, with the oldest recipient being 80 years old and the youngest being 8 years old. 15 people died. Even though the report shows that donors appeared before the hospital's ethics committee prior to their surgeries, it also reveals that the consent forms for the donors and recipients were not translated to allow them to understand the contents. The report further indicated that the consent to donate was available in all sampled files, signed by an advocate, but not translated to a language the donor and recipient could understand. Transplants were also conducted despite poor donor-recipient cross-match results. The facility lacked clinical patient morbidity and mortality reports, as there were no long-term patient follow-up reports and documentation. All foreign surgeries on both donor and recipients were cash transactions. Following the dismissal of the report, Aden Duale on April 25th suspended 2 officers. They included Dr. Maurice Wakwabubi, who was the acting head of Kenya Blood Transfusion and Transplant Services, and Dr. Evelyn Chege, the fact-finding committee's technical lead. The CS then set up a new independent investigative committee of organ transplant services.
We are developing the National Transplant Registry in order to strengthen regulatory oversight and improve responsiveness. This registry will serve as a centralized system to monitor donor-recipient matching, procedure compliance, and institutional performance.
Of who are in the team, those who dissented, and importantly, those who said that there were orders from above to sign the altered report that the ministry has actually disowned.
The committee is also expected to present recommendations for strengthening transplant services nationwide and submit the final report to the ministry by July 22nd, 2025. Helen Aura, NTV.
In other news, the